Dr. Ashish Markan. He will be presenting on quantitative assessment of peripheral choroidal vasculature in ultrawide field
2975
in posterior uveitis.
A very good afternoon to all. So I'll be talking about the quantitative assessment of peripheral choroidal vasculature on ultra-wide field ICG in posterior uveitis using advanced image processing techniques. So just to introduce, we know that with the emergence of ultra-wide field ICG, it has broadened our analytical scope to assess the choroidal vasculature, especially to look at vortex vein ampullas, the choroidal drainage and the outflow, and the morphology and dimensions of the vortex vein in various eye diseases. So this has been studied in diseases like polypoidal choroidal vasculopathy, central serous chorioretinopathy. But there is currently a lack of data on quantification of these choroidal vascular parameters in posterior uveitis. So the present study aims to bridge this gap by quantifying various parameters using ultra-wide field ICG in eyes affected by posterior uveitis. So it was a retrospective study. All these patients, they underwent FFA and ICG, and images from the intermediate phase were taken for image analysis. Only well-centered images with visualization of minimum of 3 vortex vein ampullas were included, and a Python program was used to analyze the images and to calculate the various choroidal vascular parameters. The exclusion criteria included the poor fixation, media opacities, other ocular comorbidities, and poor quality images. So what all parameters did we study? First was the asymmetry of the choroidal outflow. Second was the choroidal vessel densitometry. Third was the ampulla distance from the optic nerve. And fourth was the diameter of the prominent choroidal vessels. So to begin with, we need to do image registration. For this, FFA and ICG images were overlapped on each other, and a rotational, scaling, and translational artifacts were removed. So we received a registered image, which is the subtracted image from which the retinal vessels have been subtracted from the choroidal vessels. Now the next thing is that you apply thresholding. Thresholding basically binarizes the image. We can either apply adaptive thresholding or a global thresholding to receive a final image which is used for analysis. So firstly, the asymmetry of the choroidal outflow. It was studied in terms of the brightness of the pixel intensity on each of the quadrants. So this is how a Python program looks like. So first of all, this is the interface for the Python program. So you select the registered image, you upload it on the Python program, and then you click on this on run all. So run all has all the mathematical formulas, and it will cause the thresholding and binarization of the image. Once that is done, so it will automatically calculate the pixel intensity in each of these quadrants. So you can see the quadrants have been divided into 4 equal parts. And finally, we get the brightness of each of the quadrant. So the difference of the maximum brightness minus the minimum brightness will be the asymmetry of the choroidal outflow from that eye. Second parameter was the choroidal vessel densitometry. Again, the registered image was being uploaded onto the Python program. In this case, adaptive thresholding was applied. And you click on run all. And then you select the region of interest where you want to calculate the choroidal vessel densitometry. And the mathematical formulas, they were calculated, and it calculated all the non-zero pixels or the white pixels. So the ratio of the white pixels divided by the total number of the pixels gave the choroidal vessel densitometry of that particular eye. Third was the ampulla distance on the optic nerve. This was quite straightforward. You upload the image, then you basically select the, the coordinates. So you click on the optic nerve, you'll get few coordinates. You put it into the formula. Similarly, you go and click on various ampullas, and you'll get few coordinates. So once you receive these coordinates, so you put them into the formula, and the formula basically uses the Euclidean distance mathematical formula, and it will give the distance. It will convert the pixels into millimeters, and you'll be able to calculate the ampulla distance from the optic nerve till the vortex vein ampullas in each of the quadrant. And the final was the diameter of the prominent choroidal vessels. Similarly, again, the image is registered onto the Python program. You divide the image into 4 equal quadrants. And then what we do is, this is how the resultant image is. So it has been divided into 4 quadrants. The program will itself mark all the prominent choroidal vessels. If you feel some of the vessels have been missed, you can manually mark them. The different colors actually shows that various vessels have been marked, but all of the prominent vessels have been marked. And then the formula will automatically calculate the mean value of this quadrant. So you'll be able to calculate the mean values of each of the quadrants. So coming on to the results. So a total of 31 cases and 14 controls were included, and we had entire spectrum of posterior uveitis in the cases. The mean average asymmetry of the choroidal vessels was 14.89 pixel units. Choroidal vessel density in the cases was 0.36. So this is the ratio, so it will come in 0.36. And the distance was 10.83 to 11.45. Coming on to the diameter of the prominent choroidal vessels, it was comparable, and it ranged from 0.37 to 0.4 millimeters. So this is the first study which has actually looked at the diameter of the prominent choroidal vessels. There is no other study till now which has calculated the diameter of the prominent choroidal vessels. Now coming on to the control versus cases. So what we found was the choroidal vessel density was significantly lower in the cases. Similarly, the diameter of the prominent choroidal vessels was significantly more in the inferior quadrant in the cases as compared to the control group. So this could be because of the long-standing persistent inflammation and causing some secondary changes in the choroidal stroma and the choroidal vasculature, which could have led to low CVD. So just to conclude, our study showed that the CVD was markedly decreased and diameter of the prominent choroidal vessels in the inferior quadrant was significantly increased in posterior uveitis as compared to the control group. And this is important because quantification and analysis of such parameters can assist clinicians and researchers in better understanding the intricate changes which happen in the ocular vascular anatomy, particularly in pathologies like posterior uveitis, and provide an objective tool for monitoring and response to therapy. Thank you.
Good. New technologies, Dr. Ashish. But as you said that it was multiple, like the cases which you took were of all types of choroiditis.
Yeah.
So like if you say quadrant tick, so where were the choroidal tubercles or choroiditis patches? So that would affect the various quadrants.
That is what the beauty of Python programming is, and all these algorithms which we have used, it has automatically subtracted them. But you're right, because we have included all these patients, so there is always some variability and there is some bias which happens. So the next project is that we are trying to study only one particular subset of uveitis, because we were actually designing this software. Yeah. So that is why we tried to include all the eyes.
It could be a pilot study.
Yeah.
So because you have to study more, because you have to study where the choroiditis is, and then is that quadrant involved or not?
That is what happened, because in patients of serpiginous like choroiditis, where there were too extensive patches, we have excluded those patients, which were actually...
Otherwise, I think it's a good beginning.
Thank you.